Good morning, good afternoon, good evening, everyone. Welcome to this LinkedIn Live, how technology is reshaping the delivery of care in healthcare industry. I'm Chanki Satija, Vice President of Everest Group. I lead our healthcare and life sciences technology practice.
Hi everyone, good morning, good evening. I am Hanupriya. I am a senior analyst at Everest Group focused on the healthcare technology side of things.
Fantastic. Hanupriya, I think you can also introduce yourself as the subject matter expert for care management. Uh,
Yeah.
but Yeah, so I think just a quick word, given that this is a LinkedIn Live, we want this to be very engaging. So if you have any comments, any perspectives, any questions, please do share in the comments. We'll try and address as many of them as we can as we go along. Uh, and I think just to get this started, maybe it would be good to again know who all have joined in. So again, if you've joined in, uh, if you can mention your name and where you're dialing in from, I think then it will just help us get a view of who all is there. So, uh, so in a lot of Humphrey and a lot of my conversations, there are if I compare them with maybe say a couple of years ago, there are a few areas which now come up more often than they used to. Right. So one is obviously Gen AI, but let's put that aside for a moment. But other than that, things around care coordination, things around population health management, mental and behavioral health, I think these have come up much more often than they used to. So clearly there is some shift that is happening here. Uh, but yeah, just want interested to hear what do you think about this, right? Or a different way of asking this is why are we having this LinkedIn Live on care management?
All right. So I agree with you. There are terms like care transition, care coordination, and they were always there, but the buzz around them has increased in the recent years. And when we talk about care management specifically, so the term care management or even the concept of care management, it has been around for a few years, for quite a few years. It's just that earlier it was nurses being our care managers, managing the care for us, then it shifted to the doctors. And in the current space, it's specifically technology taking the lead in managing care for us. And when we talk about care management, so it's a very big concept and it's an umbrella of concepts that we can talk about. There are terms that you mentioned, right? It's care coordination, it's population health management. So we can say that these are like subcategories of the entire care management umbrella. But yes, so that's overall like the basic introduction and the basic talking about why exactly are we here.
Interesting. So what are some of the things that you've seen change, right? So from a care management perspective, what are maybe say the few most interesting things uh, that are that you think have changed significantly over the last 2 3 years?
So the one of the top things or top two or three of them, I would say one being there is recently there has been a shift to value based care. So basically, if we talk about healthcare costs being on the rise, right? So there has been recently been a shift from fee for service model to a value based care model, and that has been placed a very high demand or a very high emphasis on that. And this has also been helped in effective care management. That's why this has gained uh, high importance in the current arena of care management. And also there are other things like one thing around there has been a high adoption of virtual care. So we all know COVID-19, it made us all shift to the virtual care side of things, right? So there has been a high adoption of telehealth services, which enables healthcare providers to remotely monitor the patients, engage with them, help them in their treatment plans, in their treatment journeys. But all of this is done virtually and not in person or face to face. And lastly, if I talk about, then there has also been a very high focus on patient centered care. So patient centered care is becoming a central focus in the healthcare system, in the healthcare ecosystem. So care management, basically, when we talk about care management, it helps, or the focus of care management is to put patients at the center of care. We involve them in decision making processes. We keep them educated about, okay, this is the process, this is how it's going to be, this is what your treatment journey looks like, this is what the aftercare looks like. So when the patient is involved in all of this, obviously the patient is more interested in getting the care.
Interesting. And maybe I think it would be good to hear from the audience on what is the biggest challenge that you see from a care management perspective. And Hanupriya, while the audience does that, right? So one question is, I see a lot of people use care management and case management interchangeably, right? So I think clearly there is, I mean, different people define this differently, right? So how do we define this? Do we have a definition?
Sure. So there are a lot of times when care management and case management is used interchangeably. And it's not just interchangeably, there are times when some of the healthcare systems say that, okay, case management is a subset of care management and vice versa. But for us at Everest Group specifically, when we talk about case management, it is one of the subcategory of care management for us. So care management is the entire plethora of care that is being taken care of, care that is happening for the patients. And when we talk about case management, as we can see, right? So it is one of the subcategories wherein we go by the term case. So basically, we are taking care of the patients, or we are managing care for the patients case by case. So that's one by one. That's individual for one patient to the another. And it's not just case management where we stop defining care management. It's again an umbrella of things. So we have care outcomes improvement. In here, we are talking about all the some of the terms that we initially started with, right? Care planning, we have care coordination, we have mental and behavioral health, and we also have disease management. Now then we move to population health management. So this talks about value based care that I talked about, right? There has recently been a shift from fee from service model to value based care models, because everyone, or the entire healthcare ecosystem, is interested in improving the quality of care that is being delivered, in making it more patient centric, and at the end leading to improved health outcomes as well as the final decision that we talk about. And then we also have health and wellness management, and this is something that all of us are doing, right? All of us are wearing a smartwatch right now, all of us are tracking our steps. So that is one of the areas of health and wellness management that we cover. And then we move to utilization management. So case management, as I talked about earlier, it's tackling care or taking care of the patients individually, one by one, case by case. And then we have utilization review. So utilization review, basically it means that it's not just care that is being given. For example, I'll take an example here. A patient, let's say, has to go through a hip surgery. So we go through that, but once that is done, we try to assess that, okay, what was the impact of that? Was it actually required? How effective was that? And even before going for that, we actually sit down and see that, okay, do we actually need this surgery? Do we have alternative methods that can be that we can abide to, and they will help us fix the situation for the patient.
Thanks, Anupriya. And you've spoken to a lot of buyers as well as suppliers, right? In your opinion, is this a definition which, let's say, is it a shared definition from an industry perspective? Do you see different organizations define this differently?
So largely we are aligned, and this is aligned with how the industry or the buyer side is also defining care management. There are also some of the other aspects that we can include to that. Virtual care or telehealth can be one of the, if we want, that can be one of the categories that can be included. But again, largely, if we look at how some of the buyers are defining it, or how are they offering solutions and platforms in this specific space, then yes, we are aligned. Some of them have saying that okay, we are offering PHM solutions, we are offering PHM softwares and applications, or we'll help you coordinate care. So these are the terms that are largely being adopted right now in the industry.
And we already have a question, right? So, to what extent do we expect technology to actually replace human touch when we talk about care management?
Okay, I can take that one. So we can expect technology to actually replace human touch to a lot of extent, and that's something that's already been happening, right? Every time we want to visit the healthcare provider, we are not going and seeing the provider in person. We are actually doing that virtually. Or we can also talk about something like remote patient monitoring. Every time we want to get the vitals monitored, it's not we are not going to the doctor, or we are not going to the provider to get it checked. We have sensors doing that for us, or we even have continuous tracking devices like CGMs and uh, blood pressure cuffs doing that for us, and they're tracking that continuously for us, and then the data is directly shared uh, with the providers. So that's something that's already been happening. So yes, we can actually expect that to be replaced to a great extent.
Yeah, and even I think there are other things that I think technology can help us do better, right? Care coordination is a very good example where we now have a lot more technology solutions to get the entire ecosystem together. So as I think care also gets more disaggregated, there are more stakeholders involved in a patient's care compared to say what we have been used to, right? Patient,
Yeah.
family member, or the caregiver. You have the healthcare provider, then you have the payer, then there might be a remote or home nursing
Yeah.
service that might be used, right? So there are a lot more stakeholders now involved in care, and like yeah, I feel technology can definitely in certain cases augment the human touch, and in other cases also again take away some of those I would say
Specific
repetitive.
nuances. Yeah.
Yeah. And so I think we talked about the definition, right? We talked about how we define care management. Uh, from an adoption perspective, there's obviously payers and providers, right? And there would be different, what you talked about, the different components of care management. There would be different parts that they would be adopting. Payers, some payers would be adopting to a larger extent, and others providers would be adopting to a larger extent, right? So, how do you see this adoption? Are there certain areas where adoption in payers is higher compared to providers, and vice versa?
So if we talk about adoption in pairs and providers, it's getting largely equally adopted by pairs and providers, but it's just the specific categories or specific areas within the healthcare ecosystem where care management is getting adopted. For example, if we look at healthcare pairs, so they are adopting care management solutions and care management in general more from a cost perspective, I would say. And when we look at the healthcare providers, so they are adopting care management solutions more from a care quality or improving care quality side of things. So if we go down and if we look at actually if we dig deep, right? So within care outcomes, if we talk about things, so again, mental and something like mental and behavioral health and care coordination. So these are some of the parameters or some of the areas where payers and providers are highly adopting care management. But if we want to go specific to okay, where payers are adopting it more, so we can look at value based care, because this obviously, I mean, this helps them. This helps payers in eventually reducing healthcare costs. So this is where we are seeing payers adopting care management more. But again, if we look at disease management, if we look at chronic disease management, if we look at care planning and management, these are areas where healthcare providers are adopting it more, because again, they are interested and they're involved in improving the care quality and improving the health outcomes for patients and making it more patient centric at the end of the day.
Interesting. And I think the way you mentioned it, right, that for payers, the focus is more on cost, and for providers, it's more on care quality. I think that makes a lot of sense. And even when I look at, again, where the adoption is high, right? So as you mentioned, value-based care and even health and wellness management, right, moving towards more predictive care, we are seeing more adoption by payers compared to areas which are more focused on care quality. We see more adoption by providers. Uh, and I think we had a question related to technology, right? But I think maybe a question for the audience also is, given that, again, in any conversation that we have, right, Gen AI is something that definitely comes up. So would be interested to hear audience perspective on whether they think there's potential to use Gen AI in care management, and if yes, where do you think it can be used? So, uh, Anupriya, we have talked about, again, how we define care management, how our payers and providers adopting it. But maybe let's also talk about the supply side. Uh, so, again, in a lot of whenever I've looked at areas within healthcare and life sciences, one of the things that I think clearly stands out is that innovation rarely comes from some of the incumbents, right? And in a lot of cases, innovation is coming from some of some smaller firms, or say some innovative startups. So, is that your experience as well from a care management perspective? Do you see innovation coming from some of the startups in this space?
Yes, and I completely align with that. We are actually seeing a lot of innovation, a lot of new developments in the care management space, coming in from the niche, specific, targeted care management players. And actually, we recently published a care management trailblazer, wherein we assessed the leading startups in the care management space who are offering solutions. And to our surprise, again, it was the we do see a lot of innovation, especially if we talk about innovation coming in, then there are two parts to it. So one is wherein we have a platform vendor who is offering, I would say, largely majority of the solutions within care management umbrella that we defined, right? So they would be offering care coordination platforms. They would be offering population health management, value based care. So this is one side of the things. And if we look at the other side, then there are players which are offering which have, I would say, a very mature offering, but only in one of those. So someone like a Lumion, if I remember it correctly, then they are someone who are just focused in care coordination. They have very mature offerings. They have platforms, solutions specifically in the care coordination space. Whereas if we look at other players like Virtual Health, Bamboo Health, so these players, they have largely majority of the. I'm not saying their offerings are not that mature, but they do have offerings across the care management value chain, I would say.
And you mentioned the Trailblazer report that you
Yeah.
authored, right? Can you talk a little bit about that? So, I see there are 10 startups that you identified as Trailblazers. But like, what was the overall, say, universe of startups that you assessed? And can you also talk a little bit about like how you identified these top?
Sure. So basically, how it usually goes in and how it went for me for this specific care management trailblazer report is we identified around 40 players, uh, and then we assessed them across their domain offerings, across their market impact. How are they doing? What impact are they generating in the market? Then we also assess them basis the I would say the value proposition that they are bringing out, the innovations that they are doing. So across all these parameters, we did, I would say, assess them, and finally we finally we got down to around 10 trailblazer, 10 startups basically, after the in-depth analysis that we did. And these, as you can see it on the screen, right, these are the top 10 identified trailblazers for us in the care management space. And again, as some of them, the names as I talked about, right, we can talk about someone like a virtual health who has offerings across the care management umbrella. But then we do have Exolis that is more focused on utilization management, and then we have Lumion that is more focused just on care coordination. So yes, that's largely the care management trailblazer report that I published.
Interesting. And what sets these 10 apart from the others that you looked at, right? So you mentioned that there are some that are very or very niche in terms of what area they target, and then there are some others which go a little bit broader. But what are some of the things that set these 10 apart, right? Is it more around the capability that they're bringing in? Is it more focused around maybe they're looking at this in a more innovative way? Or maybe these are the ones that have achieved more market success, right? So what is it that separates these 10 from the others?
So I would say it's a mix of all for them. If we look at their domain focus and the coverage that they have, so that's something that sets them apart. Again, focusing on the market buzz and the history that they have, that's something. Then again, if we talk about technology and innovation, so how innovative are they in the current space, right? So if we look at, I would say somebody like, I'll take an example of virtual health again, right? So they have a comprehensive platform solution called Helios. Within that, they have plug and play offerings specifically, right? So if you are interested in just a telehealth solution, then they'll give you Helios visit. If you are more focused on HIPAA compliant messaging or HIPAA compliant communication with your between the healthcare provider and the patients, then we have Helios Text. So that's where it comes from. It's not just the entire. It's not just one offering across the care management umbrella. It's basically that we are focusing, or we have a deep dive into every and or at least majority of the categories that we include in care management, right? And if you look at other examples, then we have Solis that I talked about, right? So they have specific utilization review, utilization management software called Cortex that they are offering, and they have specific technology and innovation capabilities in niche care management areas. So that's something that sets them apart. And apart from that, it's also the talent and the leadership uh, that these trailblazers have, right? So it's not just, it's a mix of all, I would say. Domain focus, the market buzz, the technology and innovation, and obviously the talent and leadership.
Thanks, Anupriya. And I think we have a question from Kaushik on similar lines, that from a supply standpoint, do we see more of integrated platform solution for care management, which cover all of the areas within care management? Or do we see solutions or platforms specific for an area? So I think this is something that you touched on, right? That like even in the 10 trailblazers that you identified, it was a mix, that there were some which were more focused on a specific niche, and then there were some which had which, let's say, covered multiple areas. Anything additional that you want to say? So for example, let's say, are there specific areas where you see presence of more niche providers? Maybe out of the entire care management, there is an area where you have a lot of startups that do just that specific thing. So anything else that you want to add?
I would say there are startups that are focusing on some of the specific offerings within care management, and they are largely around care coordination, population health management, value based care. So, these are some of the subcategories of care management, I would say, that are also getting high adoption. in the healthcare ecosystem. And again, if we see look at, I mean, that's the demand side of things. But again, if you look at the supplies, if you look at it from a supply standpoint, then yes, we do have specific, I would say, startups or trailblazers that are focusing or that are offering very mature offerings in specific areas like care coordination, population health management.
Got it. So I think we have time for maybe one or two more questions. But before that, I just wanted to talk about uh, again the call to action that we have again for people who have joined here. So uh, for those who are interested, there are we have our own published research in this area, right? So and as well as we are going to launch a peak matrix assessment on care management platforms. Maybe Anupriya, you can, if you want to talk about what that assessment is, given that you're going to be leading that, I think that would be great.
Sure. So basically, we'll soon be launching care management platforms, peak matrix assessment, and in that we will be assessing and evaluating platform vendors largely on two areas. That's one is vision and capability, and the other one would be market impact. So I would really appreciate, and I would like to invite all the platform vendors who have offerings in the care management space. And again, as we talked about it, right, it can be just one niche offering, something like a care coordination or a population health management, or it can be coverage across the categories within care management that we have. So that's what we have in pipeline for now.
Great. And so I think let's take maybe one more question. So there's a question from Devjit. Traditionally, we've seen providers investing in care management, but lately payers are also focusing on care management to improve member engagement and outcomes. So what are some of the payer trends that you see in care management? I think, Anupriya, you probably mentioned this at the start, right? That one of the reasons why we also see higher adoption of care management, or one of the things that we are seeing change, is the focus on it, more focus on experience, right? And given that how, I mean, care is the main component of it. I mean, naturally, that leads to changes in how care is delivered, etc. Right? So, uh, anything that you want to add in terms of from a payer perspective? Are there any specific areas that you're seeing? Are there any specific trends that you're seeing?
So one is obviously the cost side of things that we have, but apart from that, right, there's also high focus on customer experience. And when we talk about customer experience from a pair point of view, then it's member engagement specifically. So yes, even pairs are largely focused, and even pairs are focusing more on improving member engagement and member outcomes, basically to keep the members happy and satisfied, and that's the end goal for them, apart from the cost savings. So that's largely what we have for pair trends that we see in the care management space.
Fantastic. Uh, I think with that, I think that brings us to a close. So, thanks everyone for joining in. If you have any other questions related to this topic, please feel free to reach out to Hanupriya or me. And I look forward to speaking to all of you again. Thank you.
Thank you, everyone.